Welcome back to the Breakfast Show. We were discussing about World Cancer Day. Do people receive treatment on time and do they have proper access to healthcare? We do have online with us our next guest of the morning, Jeff Evans. Professor Evans is a leading cancer researcher at the University of Glasgow and Beeston, West of Scotland Cancer Centre. Good morning, peace be upon you, and welcome to the Breakfast Show, Professor.
Good morning. Thank you for inviting me along.
It's a pleasure to have you on. Just to get into things from your perspective as a cancer researcher, how do some people of the challenges in delivering clinical trials impact patient outcomes and the advancement of new treatments?
Thank you. That's a very good question. And most of the treatments that have been developed worldwide for cancer treatment, and that includes both diagnosis, management, investigation, and treatment, be it surgery, radiotherapy, and chemotherapy, have had the strong basis of evidence arising from clinical trials. There are many challenges globally, and that's related to the way healthcare systems are set up across the globe. We are very fortunate in the UK that we have a National Health Service, and also we're well supported by Cancer Research UK, who are our major funders of research in terms of developing novel clinical trials, so that we can bring timely novel innovations to our patients.
Yes. So, every now and then in the news, we may see or we may hear that, there's been this sort of breakthrough or this sort of thing has improved or has happened in terms of cancer research. So are there any recent breakthroughs like in cancer research or clinical trials that could help improve treatment options?
Yes, most definitely. There are ongoing improvements all the time.
Yes.
Some make incremental changes, some make quite dramatic improvements. And these span from early detection through to management with potentially curative intent, as well as in the treatment of advanced disease, where there's been a lot of investment. And certainly over the last decade or so, there's been a considerable development in the way we exploit and harness the immune system to attempt to eradicate cancer. So immune checkpoint inhibitors leading on to the next generation of immunotherapies, including cell therapy. A major challenge remains in being more precise in who should benefit the most so we can optimize patient benefit while minimizing toxicity.
Yes. Do you think that we're on the right path in terms of going towards that one day maybe cancer cells, they mutate, and of course you have to kind of once it's gone too far you can't really use the same medicine again to treat it. Do you think that we're on the right path to getting rid of cancer altogether?
Yes, one of the major advantages over the last decade or so has been our increasing understanding of cancer biology, how it develops and how it progresses, and how it becomes resistant to hitherto used approaches. And cancer evolution is a very rapidly advancing field.
Yes.
We're already increasing the cure rates in terms of long-term disease survivors from the 1970s through to the early part of this century, and continuing to make those improvements.
Yes.
The aim is that one day we will beat cancer by making it a disease that people can live with rather than die from.
Definitely. And what steps can be taken to ensure more cancer patients have access to clinical trials, especially those in underserved communities?
Yes, that's a very important question. And of course, we can consider this on a global scale where there's a variation in clinical trial provision, which in part is related to the way healthcare is set up in individual countries. The infrastructure that we enjoy, for example, through experimental cancer medicine centres in the UK may not be replicated in other countries. And also there is a variation in the prevalence of certain tumours worldwide. In the big international clinical trials, the recruitment does tend to be global rather than restricted to certain countries. However, we shouldn't become complacent, and there are some underserved communities. Yes, ethnicity is one factor. Where I work, socio-economic deprivation and access to healthcare in remote geographic communities are also equally important. And there's a number of initiatives through CIK Grand Challenges and others attempting to understand how that impacts on the biology of cancer development and progression, and how we can best exploit that clinically. And it's important that we do engage with these underserved communities to find out what they want from research rather than what we think they should want from research, and engage them and asking them to be involved. We have a number of advocacy groups, patient and public representation within all of our clinical trials. The UK probably does lead the world in that approach. And clearly, if there's underserved communities listening to you this morning, we welcome their input into our clinical research strategies of the future.
Yes, most definitely. Thank you so much for joining us this morning, Professor. It's been a pleasure speaking with you. Would love to have you on again at another time. For now, have a good morning. Take care and peace be upon you.
Thank you very much.
Thank you.